healthy lifestyle and a daily routine. So here to talk about those two disorders, we're bringing in emergency medicine physician and assistant professor at Columbia University Medical Center. We got Dr. Tsion Firew. Dr. Firew, it's a pleasure to have you. Welcome to BNC Live. But first, let's talk about diabetes, right? Why are Black people more prone to develop diabetes?
So it's multifactorial, like many diseases in general. One is genetic predisposition, and also another thing is just lifestyle. And in general, especially in public health, there's things what we call social determinants of health. The fact that people don't have access to health care because of lack of insurance or income status, people are not going to be able to seek care and their disease detected early on, like things that they could be counseled about lifestyle modifications where they're at a higher risk. So those things do lack, especially in people that come from social, that have low socioeconomic status, and at the same time because of access to care. And this is just not about diabetes. This is about many chronic conditions like hypertension, diabetes, atherosclerotic diseases, or things like with cholesterol medical problems. We see that are increased risks in people that do not have access to general medical care. And it's not only just about medicine, but it's also about diet and also lifestyle, right? People that do not have access to good incomes or to good neighborhoods, they're most likely not going to be able to walk outside. They're not going to have the right groceries that provide natural food. So all those things could actually factor into putting specifically in African Americans at increased risk of these diseases.
Dr. Firew, that actually brings me to my next question. Are you noticing folks that live with their grocery store deserts being prone to these disorders than other folks that perhaps live in an area where there's a Whole Foods or there's a grocery store that's directly across the street or walking distance?
Yeah, there's been actually a lot of social science studies about this. It's definitely about produce and also organic food access. In addition to the grocery store, also, if you look at the fast food chain and the other food restaurants that are available in certain communities are, very varied based on income status and based on what people are afford to buy also outside at a restaurant.
Yeah.
And we've seen that also more and more also with organic food and like farmers market. Those are really, if you see it, in affluent areas, and that affects about access to healthier food.
Yeah, Dr. Firew, I've had multiple male family members develop glaucoma, right? It's the leading cause of blindness for African Americans. What are the symptoms and what should we be on the lookout for? And if we can squeeze in, how do we prevent it? Is it possible? I know that's a loaded question. I hope you can break it all down for us in about a minute.
Okay, so I'll try to be very quick. So really increased African Americans are increased risk of glaucoma, especially for people over the age of 40 and people that have hypertension, diabetes, and prolonged steroid use, whether it's for asthma or other diseases, and extreme nearsightedness. So people that seems to have all of a sudden they're not able to see things from further away. I think it's appropriate to seek medical care and get evaluated for your eyes and see if there's any increased pressure or buildup at the back of the eye. And of course, this happens over time. If you have a family with glaucoma, you're a much increased risk of developing glaucoma, more 20% or so. Another thing to add right now with COVID and a lot of lifestyle people are not as active now. There's been a lot of weight gains, and that puts you at a higher risk of diabetes. People lifestyle not being as active, that puts you at increased risk of all the other comorbidities. So that could increase your risk of glaucoma. The best thing to do is go seek medical care and get evaluated, especially if the things that I mentioned earlier, that you have those diseases or if your family member has glaucoma.
And this is why it's so important for us to have this conversation, because Dr. Firew, I didn't even know that my chance of developing glaucoma increases by 20% just by having a family member, several, with that disorder. Thank you, Dr. Firew. We really appreciate that. More importantly, for that information too. Thank you. And BNC Live will be right back with more news that matters to you like that. Stay with us.